everyone, my name is Nupur and this is my audience.
Hi.
And then my dog too. So I'm going to talk to you guys about how your oral health is important to your whole body. I don't know how many of you know that your mouth is actually the mirror of your own body. If there's something going wrong in your body, your mouth is the first place where it will show. Most of the time, not every time, but most of the time. I'm a dental hygienist, I look into the mouth every time, every day. Not every time, but every day, as you can tell. I work 5 days, so I see almost so many patients, and most of the time they don't know how to brush or floss right. I'm going to show you how to brush and floss right, but before I'm going to talk to you how your mouth is really important to your body. So the mouth is actually important regarding diabetes, cardiovascular, vascular diseases, and it's actually related with the preterm birth, preterm labor. So let's start with diabetes first. So if someone has a periodontal disease, the bacteria in the mouth can actually cause insulin resistance, and that, as you know, insulin resistance is what causes a form of diabetes. And to read more about it, you can actually go to the ada.org. It's an authentic site. It's a American Dental Association website. You can go and read more about how it's related. But the bacteria which is present in your mouth, it travels down to your blood, and then it actually attacks the insulin producing cells and makes your body resistant to the insulin. Another thing is cardiovascular disease. According to the absolute dentistry, the bacteria in the mouth are bacteria which causes the periodontal diseases. It actually flows down in your body and causes the hardening of the arteries, and that hardening of the arteries leads to increased risk of heart attacks, and also increased risk of you getting the hypertension, which is also a predisposing factor for having a stroke in the future. So through the research, it's been shown that 46% of the people who had periodontal diseases actually had higher number of heart diseases. For the preterm labor, preterm labor means when a child is born before when he was supposed to. Imagine a lady, a pregnant woman, don't go to the dentist, and she just stays home and take care of her teeth by herself and never thinks of going to the doctor because she thinks that she's doing good care, but she actually doesn't know that the bacteria, which is mostly gram negative anaerobic bacteria, which is present in their the gums, it can actually attack the placenta and cause the labor, which actually further leads to a preterm and premature baby, which is not healthy, because for the premature baby, there are many risks involved. So it's always better to go to the dentist even if you're pregnant every 6 months and get it checked, your gums. And for this, you can go to actually NCBI. It's a government-funded website. You can go to NCBI and read more. Now let's talk about how to brush and floss better. I actually bought this mouth. It's not a real person's teeth. It's just something to show you. So how you brush, normally people go like this. It's the upper, and they go like this, this, and this. But the real thing is that you have to angle the brush towards your gum and make sure you're doing the sweeping motion like this. So what you're doing, you actually, and also do the circular motion. So circular and ending with the sweeping down. Circular, ending with the sweeping down. This is how you actually take care of the plaque. And make sure when you are actually brushing, make sure you're going inside like this and circular and sweeping. Circular and sweeping. This one, the interiors are always rough, so make sure you're angling the brush inside like this and sweeping up, sweeping up. So this way you can do, you can make sure that you are taking out your black really good. This is the upper, and the other way, other areas where we see most of the difficulties is down here. This is down here. This is the area where I see a lot of trouble, and this is the area. Sorry, my mouth is missing one tooth. Sorry. Yeah, I don't want you guys to lose any teeth. That's why I'm telling you how to brush properly. So make sure when you brush, circular up for the down, circular up. And right here, as you can see, this is the area where you have to brush. So go in there, circle and brush, circle and brush. This is how you're gonna do it. Now flossing. So most of the people, when they floss, they actually don't floss right. So just take this same kind of floss, and actually I'm going to need someone to help me with holding this. So I'm going to ask you, just come here and hold this for me, and so I can show you how to floss right. So most of the people, so make sure you are wrapping it around your finger. Any finger is fine. If you like the middle finger, you can wrap it around the middle finger and go in there, and instead of just going up and down, up and down, up and down, don't do that. Most of the people do it. I don't like people doing it because it doesn't do the work. Make sure you're making a C shape like this, and C shape like this, and scrubbing it, scrubbing it, and coming up. Same here. Go in, make a C shape, and come out. So I hope this helps you guys, and I hope you guys actually do better cleaning, because you know that how your whole mouth is actually related to your body. And if you don't want to get diabetes, cardiovascular disease like your heart diseases, please make sure, I know you guys are not pregnant, but maybe someone at your home could be pregnant. So please make sure that any girl who's pregnant is going to dentist and getting their teeth cleaned right every 6 months, so that they don't have any kind of trouble later. Okay, thank you guys. And this is my audience in the end. Thank you.